Hello and welcome to our show, Health and Wellness Myths and Facts. Made up of the glands that produce hormones, the endocrine system regulates almost everything that happens in one's body, controlling growth, puberty, processing food and water, and maintaining the proper levels of blood sugar. Endocrine problems are typically complex because they involve many systems and structures within your child's body. When the endocrine system malfunctions, problems arise. And hormonal imbalances in children can cause serious consequences. The burden and pattern of pediatric endocrine disorders are increasing worldwide. Symptoms of hormone imbalance can vary widely as each hormone is responsible for its own role. Awareness of hormone imbalance in children is not very high, and parents do not know much about the endocrine disorders either. Accurate knowledge will help parents recognize the symptoms in time and to help them reach out or consult a doctor accordingly. And so we have invited eminent endocrinologists to provide medically accurate advice on preventing various endocrine conditions in children and help viewers identify long-term control strategies. We have joining us on the show, we have Dr. Abhamani Baro Agarwal, a consultant endocrinologist and diabetes super specialist at the Pratiksha Hospital, the Rahman Hospital, the Arya Wellness Center in Guwahati. We have Dr. Anurag Bajpai, a consultant endocrinologist at the Regency Hospital in Kanpur. Dr. Debabrati Brar, endocrinology department at the R.G. Kar Medical College and Hospital in Kolkata. Thank you all for joining us on the show. Dr. Agarwal, my first question is to you. Hormones act on almost every cell, every organ, every bodily process, every bodily function. Do hormonal disorders also occur in children? And if so, what are the common hormonal imbalances in children?
Yes, hormonal problems also do occur in children. And the common endocrine problems or hormone problems often seen are thyroid problems, which are very common. Both underactive and hyperactive thyroid disorders are very common. Diabetes is a very increasing type of endocrine problem that is seen now and then. Then we have some precocious puberty and delayed puberty like of problems. Obesity is increasing, and also we have short stature or child if not growing properly, then there must be or there can be an underlying hormone problems. Even bones, somebody having deformed bones, somebody having bone pain, even they can have an endocrine problem, a hormone problem. Vitamin D deficiency is also considered a hormone problem.
All right, and then Dr. Bajpai, then, so what age do hormonal imbalances occur, and how can this affect your child's overall health?
Actually, the hormonal disorders can happen right from birth across all age groups, including children, infancy, and adolescence. We have so many disorders present at birth, particularly hypothyroidism, which is one condition which is often missed, and we need to screen for that. Now, as discussed, the hormones affect every part of the body, starting from growth to development to bones. So if you have a hormonal disorder, you can have a child who is not growing well, growing too much, so short stature or tall stature, having an early onset of puberty or a late onset of puberty, disorders affecting the bone, the calcium, the electrolytes. So essentially, each and every part of the body can be affected, and all these disorders are reasonably common in children. Unfortunately, they are not picked up at the right time, and that's what I think this program will go ahead in terms of improving awareness in that regards.
We certainly hope so. Dr. Bhar, learning that your child has type 1 diabetes causes a great deal of stress to parents. It also means that they have to take an active role in one's child's health, and by that I mean 24/7. How does type 1 diabetes affect a child's life, Dr. Bhar?
Yes, thank you. Type 1 diabetes in a child's life means he or she has to take the diabetes lifelong. That takes a tremendous toll in the child's mind. The child is growing, the mental maturity is not as in case of adults. So what happens is that the child is fearful and looks up on the parents. The parents have to give an active role in protecting the child from the stigma of diabetes that is existing in our society. The first problem the child faces is in school-going child. The school-going children cannot adapt with this problem that his new friend has diabetes and needs to take injections daily in the abdomen. So that is considered stigma by friends, students and as well school teachers. Often certain students have been expelled from the school, sadly enough, unfortunately, because they have type 1 diabetes. So this needs to be explained very properly to the students, the teachers, and also the parents, that such children are absolutely normal if they can have absolutely normal life, school going life, and taking injection in the abdomen is not a stigma. So that will go a lot in helping the child to mentally cope up with this problem.
Absolutely. And then, Dr. Agarwal, what would be the common symptoms of type 1 diabetes in children? And then what lab test should one do or perform to arrive at the diagnosis of type 1 diabetes mellitus?
The type 1 diabetes mellitus symptoms are like polyuria, like increased thirst, passing urine like many times in a day, also weight loss despite having a good appetite. If the child has recurrent infections over the last few months, if the child have like a wound which is not healing, so again, this could indicate towards type 1 diabetes mellitus, and in severe cases where treatment has not been taken, so in such cases, patient may come with pain abdomen, respiratory difficulty, altered sensorium, drowsiness, and even land up with coma and will require an urgent ICU admission. Again, regarding the lab test, a fasting blood glucose more than 126 milligram per deciliter and a 2-hour post-meal blood glucose more than 180 milligram per deciliter would suggest or would indicate diabetes mellitus. Also, a random blood glucose of more than 200 milligram per deciliter will tell about that the patient has diabetes. HbA1c, if we check, if it is more than 6.5, that also indicate towards diabetes, but not many patients will come with that high HbA1c. If we want to confirm that it is type 1 diabetes, then we have to do some antibody testing like GAD antibody, insulin antibody, to know that it is type 1, because in children we are getting more and more of type 2 diabetes mellitus now, because people are becoming, or children are becoming obese nowadays, and they are suffering from metabolic disorders. There is another form of diabetes known as pancreatic diabetes, and for that we have to do an ultrasound of the abdomen to see if there is some calcification in the pancreas and pancreatic duct. So the treatment of type 1 diabetes and pancreatic diabetes is insulin, whereas type 2, again, we can still go ahead with some of the oral hypoglycemic agents. So identifying type 1 diabetes is very, very important. And timely intervention is very important, because patients, we have seen that with diabetes, with type 1, with very severe very high blood glucose, sometimes have landed up in ICU, and we have unfortunately lost some of our patients because they have gone into severe complications.
All right, so then Dr. Bajpai, tight glycemic control considered an essential strategy to prevent chronic complications in people with diabetes mellitus. What are the blood sugar goals for children then who have type 1 diabetes, Dr. Bajpai?
I think one of the most important things to remember about type 1 diabetes is that these children have long years to go. So normally when we talk about diabetes being diagnosed at 40 years or 50 years, the life expectancy is such that we don't have that much time for complications to happen. So for children, they have got the whole life. So we need to be very tight in terms of complications. Now, when we talk about glycemic control, we are looking predominantly on the fasting blood sugar, the postprandial blood sugar, as well as the HbA1c, which provides us information about the last 3 months. So generally speaking, we want to keep the fasting levels approximately between 90 to 130 and 100 to 160 for the postprandial reading, and a HbA1c as close to 6.5% as possible. Another point to remember is that since every child is not the same, we have to decide based upon the age, the socioeconomic profile, the type of insulin a particular individual is, to decide about individualized targets. So the main aim is to have the best possible target nearest the physiological level without causing a significant hypoglycemia. Now we also have the continuous monitoring systems which provide information about blood sugars every 15 minutes. So we have the ambulatory glucose monitoring, which monitors for a 14-day period, giving readings every 15 minutes. And we now know that if an individual is keeping the sugars between 70 to 180 milligram per DL, around 70% and above, that time in range is the best parameter. So it's not just the absolute average or once fasting or postprandial. How much is the glycemic variability and what the sugars are in between is also important. So just to summarize, fasting of 90 to 130, postprandial of 100 to 160, HbA1c level approximately 6.5 to 7, and a time in range in 70% is what we should target to prevent long-term complications.
Then Dr. Bahar, for people with diabetes, being active provides a slew of important health benefits. Can children with type 1 diabetes play sports? And if so, what kind of sports and what kinds of exercise would you recommend? What's safe for children with type 1 diabetes?
Yes, absolutely. Children with type 1 diabetes can play sports, and actually it is fun to know that various important and famous international sports person did have type 1 diabetes, but unfortunately in our country, because the disease is stigmatized, people, especially children with type 1 diabetes, are being discouraged to participate in active sports. But this is absolutely wrong. As doctors just now discussed, if you have the CGMS machine which regularly checks your blood glucose, if you have an insulin pump attached to your body which you can inject insulin periodically automatically by this pump, then exercise and sports are actually great fun. It helps in a child's mental and physical growth. It also keeps the blood glucose under control, but we must remember certain things, that this child who is going to play with type 1 diabetes should have an adequate amount of snack like a glucose tablets or candy and adequate quantities of water in his or her bag when they go out to play. They must have an alert bracelet which says that when there is hypoglycemia, they should stop the exercise, particularly when the blood glucose levels are on the lower side, like say below 80 milligrams or 100 milligrams per deciliter. Exercise should be stopped, and when they are doing exercise or when they are doing active sports, particularly they should maintain this, that the sports activity that they are undertaking should be around the same intensity and the same amount each day. If it varies, then the glucose intake also should vary accordingly, so that it do not get the fearful hypoglycemia which you are worried about. But otherwise, there is no restriction of these children to have engagement in active sports. Thank you.
All right, so much helpful information. Let's quickly go in for a short break and come back with more with our doctors, all the other questions you want to know. Stay tuned. Welcome back to our show on health and wellness. We are continuing our conversation with our doctors here on our panel. Dr. Agarwal, let's get back to what we were discussing before the break. So do children with type 1 diabetes need to frequently check their blood sugar levels then? And how can continuous glucose monitoring help children who have type 1 diabetes? Dr. Agarwal.
Ideally, yes. Children with type 1 diabetes, they need frequent blood glucose monitoring. The most commonly used device is the glucometer, which comes many companies. And monitoring, if the blood glucose is uncontrolled or is high, then at least a minimum of 5 times blood glucose monitoring is essential, which include the fasting, 2-hour post-meal, and maybe at midnight. And if possible, if hypoglycemia symptoms occurs, we also have to check the blood glucose at that time. But the problem is frequent prick, which are painful, parents' anxiety, and as well the cost of the glucometer strips, which add on to the cost of the management of diabetes in such children. Also, if the patient or the child has well-controlled diabetes, the frequency of monitoring may be reduced. It can be made once a day, once a week, or maybe in older children and in adolescent, it can be done maybe in 15 days time, keeping in mind the cost of the strips. Again, the second question answer to that is continuous glucose monitoring, as previous doctors have also discussed, is a very important innovation in the management of diabetes mellitus. The advantages are many, like we can manage hyperglycemia very well with continuous glucose monitoring. Hypoglycemia can be identified very early and can be treated, and it is very useful in very young children, because we have children less than 5 years, less than 1 year coming with type 1 diabetes mellitus also. If somebody is doing continuous glucose monitoring, we can give a more flexible diet, because we can adjust the insulin dose according to the glucose levels, and also there will be less prick. So it is very, very important, useful, and a very important armamentarium in managing diabetes mellitus. The only issue is the cost.
All right. So then, Dr. Bajpai, then what would be the in terms of nutrition, what would you advise for kids with type 1 diabetes then?
I think nutrition is a fundamental aspect of management of diabetes, especially for children. Now, one of the major myths with parents have, and they often ask us that we can't give this aspect and that aspect, and they become too restrictive in that regards. Now, the big message I like to give is that there is no specific diabetic diet for children. So whatever is required and recommended for a healthy child should be taken up by children who have diabetes, which essentially means that they should have a balanced diet with a good amount of mixture of carbohydrates, proteins, and fats, along with minerals and vitamins. What I'm trying to say is that things which should not be taken by healthy individuals, like frequent processed foods, like packaged foods, and all the junk food, should of course be avoided, but there should not be undue restriction, because people who do a lot of restriction in terms of controlling diabetes by not controlling insulin properly, but by controlling the nutrition, often result in poor growth in that perspective. So a balanced, healthy diet is what is recommended. There is a lot of talk about fat diets like low carbohydrate diet and a high protein diet, which is definitely not recommended. So we expect around half the amount of calories, 50 to 60%, to come from carbohydrate. Fats, also the ones which are polyunsaturated, definitely would be desirable, and trans fats are something which we have to reduce in that perspective, would be around 15 to 20%, and protein of 10%. So anything that we have in our routine day-to-day in home, the healthy conventional diet is something which is recommended. The other important thing is consistency. So we need to be consistent with the carbohydrate counting, with the amount of protein we have, and to mix it with regards to the insulin and physical activity. So overall, if a child has a balanced, healthy diet, what we traditionally have in our homes is what is ideal for that particular scenario. And we don't need to be too restrictive, because that may be counterproductive in that perspective.
All right, good reminders, doctor, there. Then Dr. Brad, kids and teens with type 1 diabetes have a greater risk for other health problems, then many of which are also autoimmune disorders. Which autoimmune disorders, doctor, are associated with type 1 diabetes mellitus?
Well, the first autoimmune disease, which is coexistent often seen with type 1 diabetes, as also in many people in the general population, is thyroid disorder. So autoimmune hypothyroidism is the most common type of underactive thyroid we get in a society. And in children also with type 1 diabetes, around 25% or 1/4 of these will have diabetes and hypothyroid together. And the best test is go for a simple thyroid testing. And this test, if normal, can be repeated every 1 to 2 years according to the advice of your doctor. Second most common disease is celiac disease, which is essentially a disease which affects our gut or intestine, but it also affects the growth of the child. It affects the attainment of adult maturity of the child, and as the doctor suggested, it results in a short stature of the short height of the child. So this testing is also important. A special antibody test is available in the market, and if you negative, please repeat testing every 5 yearly, particularly if you have any gut symptoms related to this condition. There are some other disorders like say Addison's disease, which is also an autoimmune adrenal condition. The child may get recurrent episodes of nausea, vomiting, weakness. There may be some attacks of dizziness, particularly when standing up. Such tests, there are also special arrangement for them, but they are essentially rare. Other various rare disorders of muscle disease like myasthenia, skin disease like dermatomyositis, hepatitis, all these autoimmune disorders tend to correlate with type 1, but again they are very rare. So the main disorder to stress on is the thyroid disorder.
And Dr. Garbal, how can overweight or obesity cause hormonal imbalance disorders in children?
So obesity is increasing day by day, and post-COVID we have seen that obesity is become a pandemic among the children or the pediatric age group. Now, obesity is related to many problems in the child. Like obesity may be a cause of diabetes mellitus, because obesity will cause insulin resistance. It will lead to polycystic ovary disease in the adolescent girl. It can lead to hypertension in children. Even in the young children, obesity can be a cause of hypertension. Obesity can cause delay in puberty also. So children with obesity, they may have not developed puberty they may not develop puberty in the usual age. Some of them may develop puberty even at a very early age, also known as precocious puberty. There are many children who are overweight and obese, and they are very prone to vitamin D deficiency. And some of them do come to us with bowing of their legs, also known as genu varum or genu valgum. Obesity can be an indicator of some other underlying disorders as well, like Cushing syndrome. It's a tumor which leads to increased production of a hormone known as cortisol, and it starts with obesity and decrease in the height velocity in the child. Also, obesity can be one of the features in children who have growth hormone deficiency. So these children will be obese, but they will not increase in their height. So again, it can be an indicator of growth hormone deficiency. So a obese child coming to you, we have to look at the height of the child. If the height is normal, then we have to look the metabolic parameters, like the blood pressure we have to measure, the blood sugar we have to check in this child, and we have to see the cholesterol and lipid profile in this child. If the child is obese and short, then we have to look for disorders like Cushing syndrome. We have to look for disorders like growth hormone deficiency and other pituitary hormone deficiencies.
All right. Thank you so much, doctors. A lot of crucial information there you've given us for all of our viewers. We appreciate your time. We appreciate your service. Bye-bye.